Hello, my name is Amanda Kruse. I'm a registered nurse at a family practice office, and I'm here to talk about something that we kind of struggle with, even still, is our HPV vaccine. Um, I wanted to educate some nurses about the disease first, our current recommendations for HPV vaccination, as well as some tips and tricks or interventions that nurses can use in their practice to help increase our vaccination rates. HPV, or human papillomavirus, is a sexually transmitted infection. It's very common. Nearly all men and women will be exposed to HPV at some point in their lives, but with people with a healthy immune system and not repeated exposure will usually clear that infection fairly easily without even knowing, where some patients will, after exposure, go on to develop cancer. Because it is a sexually transmitted infection, most common sites of that cancer are cervical, vaginal, penile, anal, as well as throat and neck cancer in both men and women. Every year in the United States, HPV has been estimated to cause nearly 36,000 cases of cancer in men and women. And even with screening, every year 4,000 women die from cervical cancer. There are estimated 196,000 cervical precancers that HPV causes each year in the US. Unfortunately, treatment of these precancers, and of course cervical cancer, can result in limiting a woman's ability to have children in the future. As a total, HPV typically can cause 14,000 oropharyngeal cancers, 6,500 anal cancer cases, 3,500 vulvar and vaginal cancers, and 900 penile cancer cases. Every year, HPV is found to cause that many cases of cancer in the US. We do have cancer screening tests such as pap smears, but that's only for cervical cancer. We don't have a good screening tool for any of the other types of cancers that have been found that HPV causes. I've included some pictures here of cervical and oral cancers. There's no cure for these cancers. We can treat them obviously with surgery, chemotherapy, radiation, but the best method by far is prevention. And that's what's so great about our HPV vaccine that we have so readily available. There have been 3 different formulations of HPV vaccine. There has been HPV-2, which covered 2 different strains, HPV-4 that covered 4 strains, and then now the most available version is the HPV-9. It's most readily available, and I believe it might be the only kind manufactured in the United States right now. All of these vaccines protect against the HPV strains 16 and 18, and those two strains actually cause about 66% of the cervical cancers and a majority of the other cancers in the United States. HPV-9 also targets 5 additional cancer-causing types, including HPV-6 and 11. Those 2 different strains actually cause anogenital warts themselves. The two strains that are the HPV-2 and the HPV-4, like I said, are not as readily available. But if you happen to have a patient come in that was only vaccinated with the 2 or the 4, I wanted you to be aware that those were available at one time. So you very well may see those formulations in your practice. Now that we know a little bit about the vaccine itself, I want to kind of talk to you about the ACIP recommendations for dosing for the HPV vaccine. In our patients that are 9 years to 14 years old, they are recommending a 2-dose schedule as long as they get the first dose before their 15th birthday. Then they would just receive the second dose at least 6 to 12 months from the first dose. However, it's important to note that if the second dose is farther out than 12 months, that's okay. The series does not need to be repeated. However, it cannot be shorter than 6 months from the first dose. If that should happen, that the second dose is administered at a shorter interval, then a third dose will need to be administered at least 5 months from the first dose and at least 12 weeks from that second dose. There have been a lot of studies done on HPV vaccine and the 2-dose schedule, and it's shown in all those studies, it has shown that the protection is as good or better than the 3-dose series in these young adults. Now, for our patients that are age 15 to 26 years old, they do recommend a 3-dose schedule for these older patients. Or if they have certain immunocompromising conditions affecting the way they react to vaccines and produce immunity. A 3-dose series, the second dose should be given 1 to 2 months after the first dose, and then the last dose should be given 6 months after the first dose. There needs to be at least 4 weeks between the first and second dose, and 12 weeks between the second and third doses. If the vaccine is administered at a shorter interval, it should be re-administered after another minimum interval has lapsed of that 4 weeks. However, the same is true about dosing going longer than the recommended time frame. If it is longer than that 5 months in between the first and third doses, then the vaccine does not need to be repeated. You just administer that dose as soon as you become in contact with the patient. We don't want any missed opportunities. Now that we know a little bit about the HPV vaccine and how often we need to recommend to get it for our patients, I want to talk about our HPV vaccine rates here in Kansas specifically. The Healthy People 2020 target is 80%. Right now, Kansas is sitting at 62.3% for patients having at least one dose. And then our overall for patients having the complete series, whether that's a 2 or a 3 shot series, is right now at 47%. If you look down at the graphs that I've put on this slide, it shows you us compared to Kansas compared to the United States as a whole. And it looks in that first graph to the left, you can tell that we're pretty good about getting patients to take at least one dose. However, follow-ups maybe not the greatest, with our percentage rates actually coming down quite a bit from at least probably 10 points from having a complete series. Now you know where we should be with our vaccine rates and where we are. And I wanted to talk about one of the biggest hurdles that healthcare providers face as far as administering HPV vaccines. These kids are too young to give their own consent in these vaccines, and so the hesitation usually comes from the parent. The top reasons, according to a study done by Johns Hopkins, the top reasons parents decline the HPV vaccine are due to safety, lack of necessity, lack of knowledge, absence of physician recommendation, assumed not sexually active, and gender necessity. These are great talking points. It's good to know these things in nursing practice so you can prepare for what questions you might be asked. Questions about safety and, why is my young son, being offered a vaccine that is primarily taking care of cervical cancer when they don't have a cervix? It's a very good question. Patients need to be taught, and that's part of the lack of knowledge, like number 3. They don't understand that HPV can actually cause those other cancers. It's not as advertised, if you will. The information is not as readily available to them. So as nurses, a large part of our practice is education with vaccines. The absence of physician recommendation, of course, we'll talk some more in the next couple of slides about how your team can work together to have the same message come across and tackle that together. Assuming a patient is not sexually active, educating parents that the point of doing a vaccine is to teach the patient's body about how to fight off an infection before it is exposed to the actual pathogen itself. That's why this is important to do it at a very young age, so that they're not even, that their body is ready for even if they do, when they do become exposed later on. And then gender necessity, again, boys don't have cervixes. Why are we asking for that? So just that very important patient education. There are 5 interventions that I wanted to touch on today that you can implement in your clinic to help increase your HPV vaccine rates. First off, in clinics that have successfully boosted their rates, they had a designated vaccine champion. They had somebody that was there to assist and support staff to the correct usage and making them feel comfortable with vaccines. The next thing that they have also done is made sure that clinical staff was comfortable providing vaccines regardless of the visit type. So patients coming in for something other than a well child check, that we can catch those kids at those appointments as well to get them updated for their immunizations. It doesn't have to be saved just for a wellness visit. Insurances cover vaccines well. It is preventative, and so regardless of the visit type or what they were seen for that day, immunizations can be provided and will be covered. Successful clinics also implemented standardized workflows to identify patients due for the vaccine and had vaccine administration protocols. These workflows typically involve support staff, such as staff that might room patients or even schedule patients, that they can prepare the day before the appointment to identify patients needing or due for vaccines, notifying the nurse, and then the nurse and the physician can collaborate on what can be administered that day and what education they'll prepare for the patient. Clinic support staff also plays a huge role in patient perceptions of vaccines. So doing some clinic-wide training can definitely align the attitudes and beliefs throughout your entire clinic, giving the patient a very consistent, timely message around HPV vaccination and its importance. Another tip is to get some training on how to use clear, persuasive language in recommending or educating patients about the HPV vaccine. Having some unclear language or not very good scripting between patients and nurses can cause hesitancy and missed opportunities. Some outside clinic interventions that have been done with other vaccines that seem to show really good response in boosting vaccine rates, of course, are passing laws requiring adolescents to be vaccinated as a condition for school enrollment, just like requiring the meningitis vaccines for school or physicals, sports. The HPV would benefit from being included in some of those school enrollment requirements. Also, using a class-based approach for delivering vaccines would probably increase the uptake of vaccines among adolescent girls and boys. As we all know, adolescents of this age range are very peer influenced, and so giving education in their school itself and talking about it with their peers tends to increase patients' willingness to get the vaccine. In conclusion, the HPV virus is a real cancer-causing virus that can be prevented through vaccination. We learned today that we have several different types of HPV vaccine available, and they're either at a 2-dose or 3-dose schedule depending on the age of your patient. Our rates are rather low in Kansas especially, but they really show very good opportunity in catching up those kids that have 1 dose that maybe just need to finish the series. And then ending with a few reasons why patients might hesitate for the vaccine and ways that we can improve our practice to make our patients more comfortable and willing to see what a great vaccine we have here, preventing cancer and keeping people healthy. Thank you so much.